Good morning, guys. All right, we're all sparkly. It's been over 3 months since a drop of alcohol has touched my lips. How do I feel? Pretty damn good. Why did I stop drinking alcohol? Was I an alcoholic? Well, no, I wasn't, no. But I was drinking on a regular basis, much like a lot of you. And I've been doing that for a long time. It's so deeply ingrained in our society. It's how we celebrate. It's how we commiserate. It's how we end the week. How disappointing. We choose to poison ourselves with alcohol that suppresses glutamate, an excitatory neurotransmitter that keeps you alert and aware of potential threats and potential stimuli, perhaps prey that you can go and hunt. It also poisons everything else. From a TRT perspective, it can raise estradiol because the subsequent liver dysregulation that happens as a result of ingesting alcohol stimulates the aromatase enzyme. And with high estrogen compared to testosterone, you're going to feel pretty anxious. So that calm feeling that you felt on alcohol, no longer. Anxiety as a result of glutamate firing hard and estradiol causing anxiety and emotional states. And whilst it's good to be emotional, it's not good to be over emotional. So, 3 months without booze. Do you know what? I don't miss it at all. If I have had a pang, it's been a pang. I had a big bonfire the other night, and I sat there and thought, do you know what would be nice right now? Big glass of single malt whiskey. Macallan. It was a fleeting thought. I thought, well, actually, I want to train tomorrow because it's going to dysregulate my sleep like it always does. And the next few days, I am not going to be on point. And drinking alcohol means you're okay. You're getting away with being okay. But I invested in a Whoop strap and I saw my heart rate variability drop and my resting heart rate rise over the weekend from green to red every weekend. Now that's not on. I am harming myself, or I was harming myself on a weekly basis, and I could see these metrics and I thought enough is enough. My TRT protocol has not changed. It's always 12.5 milligrams of TRT daily and 100 IU of HCG daily. Sometimes I've thought my E2 must be high because I'm feeling anxious. I've checked my bloods. They're always normal. What is it? It's me. It's the other things that are impacting my brain to make me feel anxious. And because I'm a TRT doctor, I focus on testosterone. No, we don't, do we? We adopt a holistic approach because we need to adopt a holistic approach. So it's reasonably easy to dial you in from a pharmacological perspective. Careful dose titration according to effect to get you to feel good. Feeling good is a little bit more complicated than dialing you in pharmacologically. So as I say to all my new patients, I can do my job. You have to do your job. You have to put the work in to reduce your stress, to improve your sleep, to improve your diet, and to improve your training. And adopt a perspective that you've probably lost with low testosterone. You've probably seen that glass as half empty, with the inability to see the glass as half full. So you think go high or go home. High testosterone is going to make you feel amazing. You're always going to be glass half full. Disappointingly, no. Whilst raising your testosterone is going to raise your dopamine, your reward hormone, neurotransmitter, and estradiol is going to raise serotonin, your happiness chemical stroke hormone. That change in your level is artificial. So when you reach baseline and you've got high testosterone and high dopamine relatively, high estrogen and high serotonin relatively. Now we need to remember, obviously, hormones are chronic, neurotransmitters are acute. You're not going to feel great because life is about the subjective appreciation of change. So as I've said before with regards to antidepressants, saturating your brain with serotonin might seem good. In the early rave days, it was good for 8 hours, but it's had a massive negative consequence on all us guys in our 40s, 50s. Who'd have thought a life full of hedonism would end up here? Well, yeah, if you dysregulate physiology, you dysregulate physiology. There's no takesies back. It is what it is. You need to move forwards. You are in purgatory. No, you need to stay there, put the action in place to make a positive change to you, the individual. Nobody's going to do it for you. You have to do it. I can provide you with support, the necessary tools, the foundations, but ultimately it's down to you to put the work in. And if you went to somebody and they cured you, what would you do? You'd be satisfied, wouldn't you, temporarily? But when you realize every day is a new day, a new opportunity, our hormones follow this diurnal pattern, day, night, day, night, day, night, because every day is the same. We should be waking up, hunting, be predominantly sympathetic in the morning, hunting, alert, using a little bit of our parasympathetic nervous system and brain to be more calculated and considered, to then catch our prey, the reward, take it back to the tribe, move into a more parasympathetic state, calm, have a chat with the boys, hopefully have a bit of nookie, then sleep when your anabolic processes predominate. So first part of the day, activity, second part of the day, rest, sleep, and repeat. Very simple. Men are very simple. Simple needs, simple pleasures, but you must go earn your reward. Now we think, well, my reward is food. Why shouldn't I just take food then? Because you have to earn it. Now we know from a longevity perspective, your overall health and longevity will improve and increase through fasting. But if the reward is food and I can take the reward, how does that make sense? Life is all about contrast, yin and yang. You cannot have harmony without contrast. So you do need to utilize your body. As I've said before, physical beings in a world full of psychological stress. Be more hunter-gatherer. Understand your physiology. You have two sides to your autonomic nervous system. Sympathetic, parasympathetic. You've got two sides to your hormones, your steroid hormones, essentially. Anabolic and catabolic. All hormones are dependent, whether that relationship be direct or indirect, they are not independent. When you mess with one, you mess with them all. Hormones are chronic, nerves acute. Hormones affect nerves. Your hormones are essentially chemical messengers that help facilitate the function of the cell and their target organ to allow your noggin to work effectively and your brain. Now, in early days, you've made bad choices. You're now sat here listening to some dude on his iPhone after he's run the dogs. So, what do you need to do now? Yeah, you guessed it. Understand what you need to do